Hello and welcome to another interesting episode on Health Watch. Yes, we've been off for a long time, but we are back. This week we're looking at fibroid. On today's episode, our doctor will be telling us all we need to know about fibroid. Plus, on a life of the web, we'll bring a short feature on cancer. All this and more on this week's edition of Health Watch. My name is Nkem Okibe. We'll go on a short break. When we return, you'll meet my guest. Health Watch continues in a moment. Stay with us.
Fibroids are very common muscle tumors of the uterus. We know that over the course of a lifetime, probably close to 70% of Caucasian women and 80%, more than 80% of African American women will develop fibroids. Now, the vast majority of women that develop fibroids have no issues. They're found incidentally. Up to a quarter of women will actually have some symptoms that will bring them in to seek a physician's evaluation. If you're having symptoms from fibroids, there will typically be heavy bleeding or pain or pressure symptoms, sometimes increased urinary frequency. The options for managing fibroids include watching and waiting, medical management, or interventional radiology procedures and surgery. Brigham and Women's Hospital has all these options available. Most fibroids are usually discovered during a pelvic exam, either in the primary care provider's office, if the primary care provider does the pelvic exam, or in the annual gynecologic exam. And this often triggers an ultrasound or some imaging modality to get a sense of the size and location of the fibroids. Alternatively, some women will present with symptoms that trigger this evaluation, whether it's the heavy bleeding or the pressure or the pelvic pain that triggers an imaging that will lead to diagnosis of fibroids. Medical management is typically geared for abnormal bleeding symptoms. Most of the medications in that group affect bleeding but do nothing for the size and the bulk type symptoms that patient has. The only medication that is widely used that affects size and bleeding is the Depo-Lupron injection. Overall, medical management of fibroids is not as well studied as other interventions for fibroids. We know that it's sort of a band-aid, and a lot of patients will respond to the medical management, but their symptoms will return once they discontinue these managements, and often they will end up needing some other intervention in the future. The next set of options for patients are procedures done by our interventional radiology physicians. These procedures, there are two common procedures, and both of these procedures are offered at the Brigham and Women's Hospital. The most common procedure is uterine artery embolization or uterine fibroid embolization. Essentially, they target the blood vessels that feed the uterus and occlude those vessels. This leads to a decrease in blood supply to the fibroid and overall shrinkage of the fibroid and the size of the uterus. And the patient will notice usually a decrease in bulk and in bleeding symptoms after these procedures. The other option performed by our interventional radiologist is the magnetic resonance guided focused ultrasound. To qualify for a magnetic resonance guided focused ultrasound, the fibroids usually have to be of a certain size, usually limited to one fibroid, and usually in the perfect spot, meaning that they can be behind the bladder or they can be behind the bowel, because the energy of the ultrasound that's used can damage those important structures if they're not properly located.
If you're just joining us, the program is still Health Watch, reaching you on NTA Lagos Station for Excellence. We just showed you a feature on fibroid. Up next, we'll be talking to Dr. Edmond Eddie Osage, who is a fertility specialist and also a gynecologist. He spent about 30 years in the medical field, so he has thorough knowledge on what we should know about fibroids. We're telling us about the positions and locations of fibroid and the treatment options of fibroid, and also the preventive measures of fibroid, if any. Health Watch continues in a moment. Stay with us. Okay, let's look at the types of fibroids in terms of location and where is it positioned in the body.
Okay. Again, that's really important because what we call or what is referred to as a type of fibroid is really to do with the position those fibroids are.
Okay.
Okay, and those are the things that determine the impact fibroids will have. Okay. So a woman's womb is divided into the outer layer of the womb, the muscle layer of the womb, and the inner layer of the womb, and the top half of the womb, and the bottom half of the womb, and the cervix. Okay. Now, any fibroid that is located in the inner layer of the womb will have a greater impact on the woman's fertility and on causing things like heavy periods compared to fibroids that are on the outside of the womb. Okay? And they'll also have a greater impact on things like affecting the course of pregnancy if they are big enough. Okay? So the more fibroids women have, the bigger the fibroids women have, and the closer the fibroids are to the lining of the womb, the greater the impact fibroids have in causing heavy periods, in causing painful periods, in interfering with fertility, in leading to miscarriage. So essentially what I'm saying is that fibroids that are closer to the lining of the womb are the most problematic fibroids compared to fibroids that are on the outside.
Why do we find younger women these days coming down with fibroids?
I don't think there's any evidence that the age at which fibroids present has changed over time. I think what we believe is happening is that there are more women have better access to healthcare. So we're diagnosing fibroids a lot more than we diagnosed them maybe 30, 40, 50 years ago. And that's why we think that it's more common. We think that the prevalence of fibroids is the same as it was at that time. But because of better access to healthcare, because of better diagnostic facilities, we're able to diagnose these fibroids at much more readily than we did in the past.
What would you say about people that are pregnant and they go for a scan, and the scan results reads that you have fibroid, the baby is doing fine. Then after you deliver, what happens to the fibroid? You notice that it's not there anymore. What would you say happened?
Again, that's a highly unlikely scenario. What generally happens is fibroids, there are many times where we pick up fibroids for the first time on a pregnancy scan. And we call those incidental fibroids, because presumably they've not caused any problem for the woman. She goes for her scan and we pick up the fibroid. And it's unlikely those type of fibroids will cause any problems for women. And that's where the message we give out to women is not to panic when they find fibroids like that, because it's unlikely they'll cause any problems. And after delivery of the baby, it's extremely unlikely fibroids like that will also disappear. What we generally find is that the fibroids might get a bit smaller because some of them get a bit bigger in pregnancy, become more prominent, and then after the pregnancy they shrink down to smaller sizes. But generally, we're still able to find fibroids like that. But the message to women is, if you're diagnosed with a fibroid in pregnancy, seek specialist gynecological care after maybe about 3 to 6 months of the pregnancy, so that you can have a scan. Your specialist can detect whether you still got fibroids, and depending on the size, the location, and whether the fibroids are causing you any problems, he'll be able to discuss options for managing them with you.
Thank you very much, Doctor. You talked about the fact that pregnant women that could find fibroids in their scan results, and after delivery, they should also see their gynecologist or see their doctor and do a follow-up just to be sure that everything is fine. All right, it's still Health Watch. We'll go on a short break. When we'll come back, Dr. Edward Osagi is still in the house. We'll be right back. If you're just joining us, the program is Health Watch, and today's topic is on fibroids. Our doctor is still in the house, Dr. Eddie Osagi. Before we went on the break, we talked about the relationship between pregnancy and fibroids. And the question that came to my mind is, what are the treatment options for fibroids?
That's a really good question, and thanks for asking that. I think a really good place to start is to say not every fibroid needs treatment. Okay, because there are lots of women, we reckon maybe about half of women who have fibroids are not even aware of them, and they don't cause any problems at all, and they are unlikely to impact on fertility, periods, and those women do not need fibroids. At the very most, maybe if you know you have fibroids, then they can be observed over time to make sure, one, they're not getting too big, and if they do, start causing problems so that treatment can be applied at an early stage. So that's the first thing, to reassure women that not everybody needs treatment. For those who need treatment, there is a mix of different treatments we can offer. So some women can have medical treatment, especially women who maybe are suffering with very heavy periods or very painful periods. There's some medication we can use to manage those. But the mainstay of treating fibroids is surgical treatments. And the surgical treatment could be removal of the fibroid themselves. That's a procedure called myomectomy. And that can be done through keyhole surgery, through the belly button, that's laparoscopy, through keyhole surgery, through the cervix, that's hysteroscopy, or through an open abdominal cut, that's an abdominal myomectomy. Or the treatment could involve removal of the whole womb along with the fibroids in women who have completed their families. There are other treatments that involve radiologically blocking off the blood supply to fibroids called uterine artery embolization. That can be really, really useful treatments in women who have completed their family size as well. And all those options are on the table.
Are there implications of removing fibroids? Why I ask this question is, you get to see some women and they tell you, I've been told not to remove it, that I might not, it's risky and something might happen to me, so I prefer to go on live with it. And it's very embarrassing when everybody keeps saying, oh, if you're in this part of Nigeria, you get to hear things like, oh, yeah, BG, yeah, BG. And I'm like, oh my God, I'm not pregnant. So what's the implication? Is there any health implication if you remove the fibroid?
Yeah, I think the one thing we always say in medicine is any treatment we offer in medicine has a risk of complications and has consequences. And the one thing we always try to do in medicine is to offer care that is beneficial to the person receiving the care. So if you come to me with fibroids, what I would look at is, what is the impact of these fibroids on your life, your quality of life, your fertility, issues like that. And then I'll look at what will be the consequence of me removing these fibroids for you or treating these fibroids. And as long as there is a beneficial balance in that equation, meaning if I treat the fibroids for you, you're going to have a more beneficial outcome than if I leave the fibroids where they are, then I will be offering you treatment because you clearly benefit from treatments. Fibroid removal, fibroid surgery is a surgery. It is a major surgery, and every major surgery comes with its own risks and complications. So there are risk of bleeding, there are risk of infection, there are risk of blood clots, there are risk of the anesthetic. But the one thing we say is any specialist who's trained properly to remove fibroids will put measures in place to try and mitigate all of these risks. And the bottom line is that it's best for women to have treatment for fibroids that are significantly impacting their quality of life than to live their lives with horrendously heavy periods, horrendously painful periods, swollen tummies that people keep asking them if they're pregnant. Because in well-controlled situations where there's a specialist who knows what they're doing, they're working within a hospital that is well-equipped, fibroid surgery is quite safe surgery. And my recommendation would be any woman who's in that position should try and seek out a specialist who's qualified and who knows exactly how to deal with fibroids.
You say that in some rare cases, could fibroid, can it lead to cancer? The last time I visited the hospital, I saw some transparent containers. You could see that you see some tumor-like objects in them. And the question I asked was, what are these things? And the doctor talked about the fact that some fibroids, after it has been removed, wherever it came out from, the person wants to also see, the patient wants to see, okay, can we go to a test, can we find out what kind of fibroid this is? That's why I asked that question. Sure. Can it lead to cancer?
I think what I would recommend is that women view fibroid as a benign condition. But we do know that in very exceptional circumstances, cancers can develop within fibroids. And it's important to sort of demarcate fibroids that develop in women of reproductive age, and then fibroids that become problematic in women who are post-reproductive age, meaning menopausal women. Within the reproductive age, it's extremely rare to find cancer developing within fibroids. So to all intents and purposes, whenever we remove fibroids in within reproductive age, women can assume to all intents and purposes, that they are benign fibroids. But if fibroids become problematic after the menopause, then there's a higher likelihood that those fibroids could undergo malignant transformation. And it's very difficult to give exact figures, but we generally advise women that there is a 1 in 1,000 chance of fibroids removed within the reproductive age group showing cancerous change. And that falls to about 1 in 500 in women who are older and approaching the menopause.
Okay, doctor, very quickly, what would you say are the preventive measures? Because I think they say prevention is better and cheaper than cure. What's your take on that?
They say prevention is better than cheaper than cure, but unfortunately we live in a real world and not everything is preventable. And unfortunately, fibroids are one of those conditions that are not preventable. And as I said very early on in the program, any woman who lives long enough, it's more than likely going to develop a fibroid, even a tiny, tiny fibroid somewhere in her womb. The bottom line is that we really don't know why women develop fibroids in the first place. We know that women are, just because they're women, they're predisposed to developing fibroids because they produce estrogens that drive the transformation of this fibrous and muscle tissue. And there is really nothing that we know that any woman can do to stop herself developing fibroids all through life.
Well, thank you so much, Doctor. You said a whole lot about fibroids. In fact, it's very important that women out there now know that fibroid surgery is very safe. Like, that's one of the fears that a lot of women are dealing with. It's very embarrassing when you're not pregnant and somebody says, oh, I wish you safe delivery, and you're like, oh my God, I'm not pregnant. But it's good that this show is on today, and it's good that a fertility specialist like you has come on TV to talk about it. Thank you so much for coming on Health Watch.
Thank you very much. My pleasure.
Up next, moving on Alive and Aware this week, we're looking at a feature on cancer. Enjoy it. We'll be right back.
Living a healthy life means making lifestyle choices that support your physical, mental, spiritual, and emotional well-being, which include exercising, eating balanced meals, and rest, amongst others. As much as people do all of this, diseases and illnesses in one way or the other find ways into people's bodies. Some of these diseases can either be terminal or short-lived as soon as measures are taken to cure them. One of the deadliest terminal disease, which has more than 8.2 million cases of death every year, is cancer. Cancer is the uncontrolled growth of abnormal cells anywhere in the body. Many cancers and the abnormal cells that compose the cancer tissue are further identified by the name of the tissue that the abnormal cells originated from. There are over 200 types of cancer, and they include breast cancer, which is the commonest of them, lung cancer, prostate cancer, and many more.
The body is able to control the growth of cells. They grow, old, and die. But unfortunately in cancer, because of abnormality, which could be either due to a gene change or due to the environment, the cells grows uncontrollable. The old cells, instead of dying, multiply to produce even younger ones, and they continue growing uncontrollably to a stage that they start forming what we call tumor or masses. However, we also need to know that not all cancers cause masses or tumors.
At the community level, cancer poses considerable challenges for the healthcare system in poor and rich countries alike. Although causes of cancer is not known, living a sedentary lifestyle, eating improper meals, that is junk food, is said to be a contributory factor.
Exposure to too much sunlight can lead to skin cancer, especially in those who are like albinos, if they expose themselves, because they don't have the melanin protection most people in the black people have. Also, some other causes are some sexually transmitted infections like human papillomavirus, which is actually the agent that causes cancer of the cervix in women. There's also chemicals in industries. Some chemicals in industry, in chemical industry like paints, people who produce paints or tanning factories. Some of those chemicals can also lead to cancer.
Commonest among women are the breast and cervical cancers, although breast cancer is found in men at a minimal percentage. However, prostate cancer is mostly discovered in men. In recent times, researchers have shown that even children could have some form of cancer.
Cancer cuts across all age groups, basically. Cancers can, say for example, originate in the breast, but if care is not taken, they spread to the lungs, spread to the bowels.
Cancer can also be prevented if detected early. For instance, breast self-examination is one of the ways of surviving it.
If you start feeling generally fatigue, weak, unexplained weakness, you also need to start asking questions and see your doctor. Or you're a woman, you are doing monthly breast checks and you notice something like a lump in your breast, or lump or a new growth in any part of your body, is the time you need to see a health worker to find out whether it's cancer or not. Or if you're a woman, you notice that you start spotting in between your periods, or after meeting your husband or a spouse or sexual partner and you notice you are spotting, you start seeing blood after sexual intercourse, you need to see a doctor. Or you started having some abdominal bloatness, unnecessary bloatness, so you need to also see a doctor. Or you are passing stool and you are noticing blood coming out with the stool, you also need. These are some of the general signs or symptoms of early signs of cancer in which you need to see a health worker immediately.
Awareness campaign is a measure adopted by health professionals to spread information about breast cancer.
Cancers are in various forms. There's breast cancer, there's different kind of cancer. I know cancer is a disease which kills slowly.
I just know it's a disease that is quietly kills a human being. If you don't have early detection, like if you don't go to the hospital early to detect that you have cancer, it can easily kill you.
Cancer is one of the deadly diseases, and it grows in the breast, any part of the body.
Cancer is no respecter of persons. Lifestyle modifications, which is regular exercise, eating a lot of fruit and vegetables, and regular checkups are key to surviving it.
And that's the much you can take on this week's edition of Health Watch. Remember that fibroids, the surgeries are safe, as we heard from the doctor today. If you need to go for a surgery, it's safe, you'll be fine. If you need to speak with your doctor, please do so. And if you're pregnant and the test result also shows that there's fibroid, please you need to see your doctor. There is no need to fear, there's no need to be afraid. It's important you always go for checkup and speak to your doctor. Send us a mail at okibencamp@gmail.com or healthwatch@nta10@gmail.com. Send a text only to 07060865487. Remember that health-conscious people live long. My name is Okibe, and it's been a wonderful time together. See you next week.